Hello, everyone, and welcome to the series of Digitech Health Leadership Talks promoted by this year Young Executive Leaders, nominated by the International Hospital Federation. This is one of several webcasts developed by the group focused on digital and technology-driven transformation. My name is Katia Ferreira, and today we have the privilege and honor to have with us Dr. Filipe Costa, a digital health leader, a renowned professor, and a value-based healthcare expert, which is now the head of value-based healthcare at one of the major group of private hospitals in Portugal. Due to his innovative work back in 2019, he even received an award from the International Hospital Federation for excellence in quality, safety, and patient-centered care for the project development of an e-PROMS tool as the main concept of outcome measurement at his hospitals. Good morning, Dr. Filipe. First of all, thank you for your accepting our invitation to share your vision with us. And the first question is about yourself. Please tell us a little bit about yourself, your career, and your position, and how do you position yourself in the field of digital health?
Okay. Thank you very much, Katia, for your kind invitation. So my name is Filipe Costa. I'm Director of Value-Based Healthcare of Group Saúde. I'm a professor at the Nova School of Business and Economics, and I've been dealing with the research and development of healthcare, and mainly value-based healthcare in the past decade. Let's say that I have a background on healthcare management, on an MBA, and I'm just finishing my PhD about the difference between theoretical approach and practical approach implementation of value-based healthcare. And let's say that my full passion has been along the way learning from back in US, in MD Anderson and several other hospitals, then back to Portugal with the public sector and now private sector developing these kind of strategies and putting in practice. So I'm at the moment out of 21 hospitals dealing with value-based care. Mostly 44 pathologies that I've been doing with the full cycle of care, and it's quite a challenge to put it in practice, really, but it's possible, and so it's this kind of approach that I'm doing it in the last years, which is doing, learning, and researching value-based healthcare and putting in practice. That's mainly what I do in the field now. And the connection to digital health, it's quite important because you don't have the capability of measuring if you don't have the possibility of the capturing the data from the healthcare. And so digital is the step for you to interact with healthcare without creating any additional burden to the guys that are dealing with the traditional way of healthcare delivery. I'm saying that you have a traditional approach, yes, but the register has been having a quite development, and that's one of the approaches that I think we should be pointing out. And I think in the next development of our conversation, I'm going to pinpoint some of the details about that.
The first question is, how do you think that mobile health and telehealth contribute to better patient outcomes from the perspective of value-based healthcare?
Yeah, thank you very much, because that's a very important question, and that's something that I've been putting in development in the last years, because the concept of digitalization of the patient is something that comes previously from just putting an application just to the patient. Okay, you really need to create an environment and a culture organization model that you can engage this tool as being an helpful model for everyone on the chain of supplier. So if you're creating an opportunity for you to interact and create more connection with your patient, you should have the correct tools. But first of all, the patient needs to know that the tool that you are using is really to create an added value for the whole system and relationship between all stakeholders, And the other stakeholders, like for example physicians or doctors and nurses, need to look to the process of health as a step forward, help of to interact more with the patient, and that creates a very great challenge model, which you need to really create the culture organizational model for you to develop this interaction between the tools that you have and what you want to achieve. And if you are looking to the chain of value and you're creating value for the patient with creating the best outcomes for the patient with the correct costs, you should have a very good analytical tool for you in the step forward moment. Should be analyzing what's the outputs of everything. So it's mandatory. It's the same. It's the six model of the value agenda, which Porta described. You should have a digital platform for you to connect directly without an additional burden from the ones that are registering the whole this model, and that creates an environment where everyone is speaking the same language. You're capturing the data, and you're not adding an additional burden from all the physicians that you're having.
And how do you feel that society is embracing the mobile health and the telehealth systems? What do you think are the fears and constraints that people feel with these new technologies?
Yeah, I think that, if you look to the data, we have in Portugal more than 86.5% of people with an average age above 85 years old that are using smartphones. So the use of the tools, it's not a big deal. Okay, for example, you have another experiences in financing where you really pass it over to all digital approaches. But what I think it's the major goal step is that you really need to create the sense of urgency, like Costa said, and you need to create the correct pathway to people to know that that is not a problem; it's an added solution. So if you're entering progressively, you have two possible ways of creating a better engagement. First, it's external motivation or internal motivation. What are you dealing with as? Okay, are you dealing with external motivation for you to use the tool and have feedback of what you're using? Okay, or is just an intrinsic motivation that you really want to do it? Okay, because you have a higher approach concerning what's your outcome when you're dealing with this. So the biggest fears on society is mainly the unknown thing. Okay, the chaotic unknown outcomes that we are creating. Okay, so if we have a correct vision of what's the return of your investment at this point, then you have a more predictability of using that kind of tool. If you're just concentrating and saying you have to use it, your return is going to be very low. Okay, so people need to know this is not a panacea. This is not something that you're imposing to use. This is something that you have to create the necessity for you to be in the system. And the system for that should be a society approach of healthcare in digital way. Or else you're giving the wrong message to the patients. In one side, you're writing on the paper the prescription. On other side, you're asking them to fulfill their weight and on an application. It doesn't match it. Do you understand? So you really need to create the shift point for society to embrace this as a normal thing, and that's what breaks fears and difficulties, because fears and difficulties are on a lower level of conscience where it's up to your values. So to change the values that you have, you first have to act on the context. Then you'll create a loop of changing the perspective of your in values that you really need to change. And after that, it's much more easy for you to comply to up to the use of process of digital health.
What do you think about the Portuguese strategy of mobile health and telehealth solution?
Yeah, this is a very challenge question. I think Portugal is a country with a lot of variability. It's a country that you can pick it up the best and the worst, and but mainly the problem is not having the best or the worst. It's not people, it's not the hospital learning with the ones that are already doing better, and that is for me is a problem. It's a problem of cultural methodology. It's a problem of organization. It's a problem of high political stage. So, for me, when I look to the implementation strategy for the country, first of all, I'm very unhappy to say that there isn't. There isn't a strategy that you can say correctly what are going to be the achievements on a quick step, medium range, and high range of achieving this kind of results. What you want on a low range stage, okay? You want to have the connectivity. You want to have the use of this kind of tools. And I think COVID brought us a big challenge, but mainly of all, and I can wrap it up among this, brought us a lot of opportunities. A lot of opportunities. So I think one of the important things is that if you don't have a strategy and you don't have a country strategy for you to develop that kind of approach, where I'm going to be here in 2 years, 5 years, 10 years, what do I need to do, not locally, but globally? And what do I need to be looking not to public or private, to be looking to a national strategy? Then you should have a more engaged perspective of what you are creating. And the second thing is that what we call literacy, not only among the patients, but among the systems, okay? And one of the very important things is that if you are going to have a country strategy, you should have a good regulation, or else you're creating the unknown that I told you in the beginning. You cannot create the unknown. You should have the predictability, possible outcome for using this kind of tools, for using this kind of methodology, because this is changing the actual methodology. This is changing the actual perspective. So if you really need to have a strategy, create a strategy from the beginning. Create a model of teaching, because you cannot have traditional model in teaching of medicine, okay, of consultation in your teaching model, and then when you go to the hospitals, you start changing their mentality. It cannot happen. You start from the beginning. You start from education, and then you create a different mindset for the ones that are delivering healthcare, okay? And then you have to have, I'm already saying what's the kind of strategy that should be applying, but I'm seeing so very good examples in Portugal that for me it's very difficult not to have a lot of people to know what it can be a strategy among the country. It's so difficult, but at the same time it's so clear, do you understand? Because you have a very good example. Why shouldn't you pick the good examples and transpose it and create a larger model among the system? Okay, but I think there's a lot of things that have been happening, challenging a lot the health and telehealth strategy nowadays. So it's being more demand bottom up to the strategy, political strategy, than a clear pathway of a country strategy, political way.
Do do you think that this COVID-19 pandemic came to accelerate the real adoption of mobile health and telehealth, or it was just at the momentum?
No, I think we are losing the great opportunity that COVID-19 brought us. Let me say that we have an increase of 3,000% of the healthcare and video consultations that we had previously from COVID. And the thing is that the consultation didn't lower so much after this changing. Normally, if you look to a principle for before COVID-19, you had a lot of struggle concerning doctors, the implementation of measuring outcomes from a larger perspective and for a telehealth perspective, do you understand? And even to do this kind of video consultation, to be next to the patient by a video consultation, it was not possible. I had a lot of specialists who were saying it was not possible because we have to touch the patient, we have to examine, so on and so on. Then it came COVID-19, and in an emergency part, you really change your perspective. So where's the rationality that you and your principles of saying what you were saying previously about that? It ended. Why? Because you create the sense of urgency for you to change. And that creates a huge opportunity because you really start doing things, expecting the results because you couldn't have another outcome because you were away from patients. And you realize that this is a very, very important way. And you can even see one other thing. You have a more engaged, empowered patients that are much more worried about their healthcare system. And it's very, very, very different. And what I think is that we have huge opportunities, and we are in the line that we could have embraced this as the new normal, not totally fully like it was, but with a balance. You understand? And for that, you have to have criteria. What's the criteria for a telehealth monitoring model? What's the rules of engagement? It's only first consultations, it's second consultations. What kind of pathologies we want to measure? What kind of things are capable or not capable? Okay, and we are losing the time. We are losing the opportunity to be an additional tool for you to be creating the best outcomes for your patient.
And what do you think that should healthcare stakeholders do to realize or to achieve the potential of telehealth?
Yeah, I'm quite biased about this methodology because I'm using a lot of technology, ML, to measure outcomes for the patient. But I can never forget a long time ago when I started measuring and putting this in practice. And one patient told me one thing that I will not forget. And he told me, "Why didn't you start earlier to talk with us?" And I think, and the proof that I have is that ML and telehealth, it's not creating what clinicians were saying in the beginning, that it was to spread the connection. No, it's the opposite. It connects more. Why? Because you have opportunities to be more close, more routinely engaged, and you have the patient that is more connected with you because he feels that the gap is lower. Okay? Sorry. And if the gap is lower for you to connect with you, you have more connection, and your active contract, because everything that you do there, it's a contract that you're creating. It's much more, it has more strength. With that strength of connection, comes another challenges. Okay, but I prefer to deal with the challenges of a higher connection than the challenge of not having that kind of connections. So I think the new generation, which is not already new, it's what is happening now, should first realize that this is not an alternative. This is the reality. Second, you should teach all the stakeholders to have this kind of methodology as a new normal. But for you to accept that, you really need to create the rules of engagement. What's the rules? What's the bias? What's their barriers? Okay? What's the guardrails? Okay? And then you need to create two other things. First, you really need to measure and develop a very important thing that in healthcare it has been so difficult to measure, but in the all other industries it's traditional measure, which is called trust. You need to measure trust, and the more trust you create among all stakeholders, the more create the other tool and the other objective that you should achieve with your next generation, which is a shared consciousness for you to achieve better outcomes for the patients. A shared consciousness. It's mandatory. You don't need to be healthcare managers. You don't need to be doctors. You don't need to be clinicians. You don't need to be assistants. You don't need to be technicians. No. Everyone has the same purpose. And if everyone is creating the same purpose, creating really value for the patient, then you're doing a very important thing. And telehealth and mHealth is just another important perspective for you to connect with this value chain. Okay? So this is not the revolution. This is a need for you to have it, to implement correctly, to have a clear strategy, clear guardrail, and a clear achievement and outcomes what you want to deliver. Because we are only here to create better outcomes for the patients. We're just giving it an extra tool, an extra methodology to achieve that. Okay?
Which is the first, if you had to give just one advice to this young generation of healthcare managers in order to achieve the full potential of mobile health, just one recommendation, which would be?
Start now. Don't wait for perfection. Like I normally tell my students and people that I work from the beginning, I started with paper and pencil. It's not digitalization, but it's the principle to know how to do things right. And I start doing it. I start capturing, I start looking at it, I start analyzing it. But don't wait for the perfect tool. Don't wait for the perfect system. Do it as you have it. And with the Internet of Things, and the possibility of free options that you have, start using. But you know that you have a very important responsibility, because with the digitalization of the patient, you need regulatory approach. And you don't have it. You don't have it correctly. But be aware that you need to start. You have to start. Start with a pilot. Start small, think big, but start.
The last question is, how do you feel or see the mobile health and telehealth solutions and technologies like far away from now in 2015 or something? How do you see the healthcare system and the mobile and telehealth medicine all together?
Yeah, absolutely. how I see it. I see it as I told you, a complementary approach, but this will create a virtualization of the hospitalization of the patient, or the cycle of care of the patient. You will achieve from the beginning to think what is virtual and not virtual. Okay, for example, you never thought of sending the patients of a high surgery one day post-operatively to home and continuing the hospitalization at home. You never thought about it, okay? But now it's going to be a new normal, okay? So hospitals are going to be a high-intensity place for you to achieve the better outcomes for that kind of moment. But then virtualization will create a society where healthcare treatment, it's not locally, but it's broadly. That's what I think is going to happen.
Thank you very much. It was a really nice conversation. It was really a privilege and an honor to have your vision from these teams. So thank you in the name of the whole group, and thank you very much.
Thank you very much. It's a huge pleasure, and we should never forget that we are just picking up and reaching the tools to really add value for the patients. That's our mission. What we can enlarge with the whole tools that we have and methodologies is just to create better outcomes for the patient with the correct cost. That is our mission among doing healthcare. So let's not trick ourselves. Let's just use it and really create better outcomes for the patient, because that's what we should be doing. Okay. Thank you very much for your invitation. It's a privilege to be giving the opportunity to speak about this such important thing.
Thank you.
Thank you.